Incontinence is helped with core exercises. That's the subject of this video. Stay tuned. Hey, this is Dr. Shakib from Core Pelvic Floor Therapy right here in Irvine, Orange County. So many people think incontinence is directly a bladder issue. Well, it is, but not necessarily, because there are different things to pay attention to. Is the bladder itself capable of messaging you to evacuate it? Are the nerves involved in recognizing what's happening intact and in good shape? Is the pelvis positioning important? The answer is absolutely. That's like the worst, I shouldn't say worst, but it's the least addressed issue that people receive in the treatment of incontinence. Listen, your pelvis is the house where your bladder sits in. If it's tilted forward or backward, it's going to apply pressure one way or another. So we can't disregard that. That's just mechanics of it. So how do we keep the pelvis balanced? Have you even addressed that? Regardless of what else is happening, the positioning of your pelvis has been compromised as a result of having reached to that level. So you may have had legit reasons why your bladder is having issues, but in the process of having these issues, your pelvis malpositioning is feeding the problem as well. So if you're addressing the cause of whatever else is there, but not addressing the pelvis, you are not going to have a full resolution of your incontinence. So pelvic positioning is important. Pelvic positioning is directly at the mercy of how you're moving. The connection of your hips to the pelvis, the connection of your spine to the pelvis, the type of breathing you're doing. I mean, they're coming up with all different versions of breathing. The reality is your breath makes a huge difference, and we're not gonna make up breathing. We're gonna go watch the kids, little babies, and how they breathe. How is it that they're going from helpless babies to running toddlers without being coached on the subject? We're innately doing them. So those are the things we need to pay attention to, incontinence or not. If you have any questions, make sure you use one of the methods of contact in the description box. Follow us on social media and make sure you subscribe to the channel. Hope this helped. Take care.